Have you ever wondered how nurses acquire the skills needed to save lives? Well, the secret lies in clinical training. Yes, it's that pivotal part of a nurse's education that transforms a student into a proficient healthcare professional. Picture this. You're sitting in a classroom absorbing all the theoretical knowledge about nursing. You learn about anatomy, physiology, diseases, and the treatments. But how do you know when and how to apply this knowledge? That's where clinical training comes in. It's the hands-on counterpart to the theoretical groundwork, providing a chance to apply that knowledge in real-life situations. Imagine being able to practice inserting an IV, dressing a wound, or even handling a critical emergency before you ever step foot into an actual hospital setting. That's the power of clinical training. It's not just about learning nursing procedures, it's about understanding the nuances of patient care. Clinical training is the cornerstone of nursing education because it gives you the opportunity to interact with patients, to understand their needs, and to empathize with them. It's about honing your communication skills, improving your critical thinking, and boosting your confidence. It's about making mistakes in a controlled environment and learning from them, so when it's time to step up, you're ready. But it's not just about the technical skills. Clinical training also teaches you about the ethical aspects of nursing, about maintaining patient confidentiality, respecting their rights, and upholding the dignity of the profession. And let's not forget about the importance of teamwork in healthcare. During clinical training, you'll work closely with your peers, mentors, and other healthcare professionals. You'll understand how a hospital functions, how different departments coordinate, and how every team member plays a crucial role in patient care. So you see, clinical training does more than just prepare you for the nursing profession. It shapes you as a healthcare professional, ready to provide the highest quality of care to your patients. Indeed, clinical training forms the critical bridge between classroom learning and actual patient care. Now you may ask, what does the clinical training process entail? Well, let's delve into it together. The clinical training process is a three-step journey that starts even before you step foot into a healthcare facility. The first step is pre-clinical preparation. Here you'll be exposed to theoretical knowledge about various aspects of nursing. This includes studying anatomy, pharmacology, and patient care principles. So, before you even get to interact with a real patient, you are equipped with a solid foundation of knowledge that you can apply in practical situations. Then comes the second step, on-the-job training. This is where you get to put what you've learned into practice. During this phase, you'll be under the supervision of experienced nurses or clinical instructors. They will guide you as you perform various tasks, ranging from conducting physical examinations to administering medications, all while ensuring patient safety and comfort. Remember, making mistakes is part of the learning process. It's through these experiences that you become more proficient in your nursing skills. Last but not least, the third step is post-clinical reflection. This is a crucial part of the process that often gets overlooked. After a day's work, you'll reflect on your experiences, identifying what went well and where you could improve. It's during this time that you consolidate your learning and develop strategies for future practice. This reflection isn't just about self-assessment, it's also an opportunity for feedback from your mentors and peers. They can provide valuable insights that can shape your growth as a nurse. So, there you have it. The clinical training process is more than just a series of tasks. It's a comprehensive journey that ensures you become a competent, confident, and compassionate nurse. It prepares you for the real world of nursing, where every decision can make a significant difference in a patient's life. In essence, clinical training is a cycle of preparation, application, and reflection. Let's dive deeper into the first stage, pre-clinical preparation. At its heart, pre-clinical preparation is about gaining a foundational understanding of the patient and their health condition. It's an essential first step that equips nurses with a comprehensive perspective before they step foot into the clinical setting. Think of it as laying the groundwork for all the practical training that follows. So what does pre-clinical preparation entail? Primarily, it involves studying patient cases. This means delving into the patient's medical history, understanding their current health status, and becoming familiar with any ongoing treatments or medications. It's about piecing together a holistic picture of the patient's health journey. But it's not just about understanding the patient's health condition. It's also about anticipating and planning for what might come next. This requires nurses to draw on their theoretical knowledge and apply it to real-world scenarios. They need to contemplate potential care strategies, considering the best possible intervention for the patient's unique circumstances. For instance, if a patient has a chronic condition like diabetes, the nurse must not only understand the disease, but also anticipate potential complications and devise an appropriate care plan. This might involve considering the best ways to manage the patient's blood sugar levels, anticipating potential risks, and planning for emergencies. Preclinical preparation also involves understanding the patient's personal circumstances. This might include their lifestyle, their support network, and any cultural or psychological factors that might impact their care. By considering these elements, nurses can provide care that is not only medically sound, but also culturally sensitive and personalized. Finally, preclinical preparation is about preparing oneself. It's about developing the right mindset, honing one's skills, and fostering a sense of empathy and compassion. After all, nursing is not just about medical knowledge and technical skills. It's also about providing care with kindness, understanding, and respect. In essence, preclinical preparation is about equipping oneself with the knowledge and perspective needed to provide the best possible care. It's about understanding the patient, planning for their care, and preparing oneself for the journey ahead. Preclinical preparation sets the stage for a successful clinical training experience. Once prepared, it's time for the core of the process, on-the-job training. On-the-job training is the heart and soul of the clinical training process. This is where the rubber meets the road, where theory meets practice, where the classroom meets the clinic. It's the moment when nursing students step out from the safety of textbooks and lectures and step into the vibrant, unpredictable, and rewarding world of patient care. Think of this phase as an artist stepping up to a blank canvas, armed with the knowledge of techniques and styles, ready to create a masterpiece. Equally, nursing students, equipped with their theoretical knowledge and practical skills, are ready to embark on their journey of healing and care. This is where nursing students get to work with patients under the guidance of experienced nurses or instructors. It's a bit like learning to ride a bicycle. At first, you have someone holding onto the bike, guiding you, making sure you don't fall. But as you gain confidence and skill, they let go, and you're cycling on your own, navigating the path ahead. This is a pivotal point in a nurse's training journey. It's where students get a taste of the real world. They get to understand patients, not as case studies, but as people with feelings and fears. They learn to administer medication, care for wounds, comfort the distressed, and communicate with families. They experience the joy of a patient's recovery and the sorrow of a patient's suffering. It's about more than just medical procedures. It's about empathy, communication, teamwork, and resilience. It's about understanding that as a nurse, you're not just treating a disease, you're treating a human being. This stage of training is challenging, no doubt, but it's also exciting, rewarding, and profoundly transformative. It's where students grow from being learners to becoming healers. On-the-job training offers a first-hand experience of what it means to be a nurse. It's where you learn to combine your knowledge, your skills, and your compassion to make a real difference in people's lives. It's where you discover the true essence of nursing, the art of caring. After a day in the clinic, it's time for the final stage, post-clinical reflection. This stage is as crucial as the hands-on experience you've just had. It's like the cool-down after an intense workout. It helps your mind process and make sense of the day's events. Post-clinical reflection is the act of reviewing your experiences in the clinic. It's about taking a step back, analyzing your actions, your decisions, and the outcomes. It's about asking yourself, what went well? And equally important, what could I have done better? It's an opportunity for introspection, a moment to understand your strengths and identify areas that need improvement. But remember, reflection isn't just an individual exercise. It also involves discussing your experiences with your peers and instructors. A fresh pair of eyes can often see things from a different perspective, offering insights that you might have overlooked. These discussions can provide valuable feedback, enhancing your understanding of the situation. Consider your peers and instructors as partners in your learning journey. Their observations and insights can help you grow. It's like having a mirror held up to your practice, reflecting not just what you want to see, but what you need to see. Reflection also extends to considering the emotional aspects of your work. Nursing can be emotionally intense, and it's important to acknowledge and address these emotions. Remember, it's okay to feel and express your emotions. It's part of being human, and it's part of being a nurse. Lastly, reflection isn't a one-time activity. It's a continuous process, an ongoing journey of learning and growth. It's about building on your experiences, learning from them, and continuously improving your practice. It's about striving to be the best nurse you can be, one day at a time. So after each clinical day, take time to reflect, review your experiences, discuss them, learn from them, and identify areas for improvement. Because, as they say, the day you stop learning is the day you stop growing. Post-clinical reflection ensures continuous learning and growth. But what role do mentors play in this process? Well, let's dive into that. Mentors in the realm of clinical training play an indispensable role. They are the compass that guides nursing students through the labyrinth of clinical practice, helping them navigate the complexities of patient care, medical procedures, and hospital protocols. Mentors are not just teachers, they are guides and supporters. They provide a secure foundation for students to build their practical skills on. They're the ones who can turn abstract textbook knowledge and classroom lectures into tangible, real-world experiences. They help students connect the dots, bridging the gap between theory and practice. Their role extends beyond the clinical setting too. They're there to provide emotional support, to listen, and to give advice when students are feeling overwhelmed or unsure. They create a safe space for students to discuss their concerns, ask questions, and express their thoughts without fear of judgment. Feedback is another crucial element mentors bring to the table. Constructive criticism, when delivered appropriately, can be a powerful tool for improvement. Mentors provide this feedback, helping students recognize their strengths and identify areas that need improvement. They're there to celebrate successes, but also to guide students through their failures, turning them into valuable learning experiences. The role of a mentor is also to model professionalism and compassionate care. They demonstrate how to interact with patients and their families, how to maintain patient confidentiality, and how to handle difficult situations with grace and empathy. By observing their mentors, students learn not just the how, but also the why behind their actions. In the challenging world of clinical training, mentors are the steady hand that guides students through the storm. They provide the support, guidance, and feedback that are integral to the growth and development of competent, confident, and compassionate nurses. In essence, mentors are more than just a part of the clinical training process. They are the lifeblood of it, the guiding force that helps shape the nurses of tomorrow. Mentors are the guiding light in the journey of clinical training. Clinical training is rewarding, but it also comes with its share of challenges. One of the most common hurdles in clinical training is dealing with difficult patients. It's not unusual to encounter patients who are uncooperative, disrespectful, or even outright hostile. This is especially challenging for nursing students who are still learning the ropes and finding their footing in a clinical setting. It's essential to remember that these patients are often dealing with pain, fear, or confusion, and it's our duty as healthcare professionals to provide the best care possible, even under trying circumstances. Another challenge is managing stress. The healthcare environment can be high pressure and fast-paced. It's a place where split-second decisions can mean the difference between life and death. This can put a tremendous amount of stress on nursing students who are still learning. It's important to develop effective stress management strategies early on in your training. This might include mindfulness exercises, regular exercise, or just making sure you're taking enough breaks. Balancing academic and practical learning is another challenge. Nursing students need to excel in both theoretical knowledge and practical skills. It's a delicate balance to maintain. Too much focus on the academic side might leave you unprepared for real-life situations, while an overemphasis on practical skills might leave gaps in your theoretical understanding. It's crucial to strike a balance between these two aspects of your training. Lastly, there's the challenge of self-doubt. As a nursing student, it's natural to question your abilities, especially when you're just starting out. Remember, confidence comes with experience. Every nurse has been in your shoes at some point, and they've all faced these challenges and come out stronger on the other side. Overcoming these challenges is part of the learning process and makes one a better nurse. Every challenge you face and overcome is a stepping stone on your journey to becoming a competent and compassionate nurse. So embrace the challenges, learn from them, and use them to grow both professionally and personally. So, what have we learned about clinical training for nurses? We've delved into the significance of clinical training, establishing it as the lifeblood of nursing education. It's where theory meets practice, and nursing students get to apply their classroom knowledge in real-life scenarios. We've walked through the clinical training process, starting with pre-clinical preparation, where students learn essential skills and techniques. Then we moved on to on-the-job training, where students get a taste of the real world, dealing with actual patients under the guidance of experienced nurses. We also highlighted the pivotal role mentors play in this process, guiding, supporting, and instilling confidence in the students. Finally, we acknowledged the challenges in clinical training. It's not an easy ride, but it's these hurdles that test a student's mettle and prepare them for the realities of nursing. Remember, clinical training is a journey of continuous learning and growth, shaping students into competent, confident nurses.